Hi everyone, Dr. Rebbe from Pain Free and Fit and Posture Size. Today we've got a great pain relieving and conditioning exercise for those of you with low back, spondylolisthesis, stenosis, or Facet syndrome, known as the single leg hip extension posterior pelvic tilt. So those of you with spinal stenosis, spondylolisthesis, or Facet syndrome realize that most times pain is aggravated and the symptoms are worse when there's too much spinal extension. That's an overarching of the lower back. Many times this is related to tight hip flexor muscles in the front of your pelvis and legs, which cause the pelvis to tilt anteriorly, meaning the pubic bone drops lower than the tailbone. Normally, when we're standing, they should be level. A lot of therapists and doctors recommend posterior pelvic tilting, which is the act of tucking the tail under, using the lower abdominals to pull the pubic bone up in an effect to decrease the curve in the lower back, open up the back of the spine, and decrease the pain of spondylolisthesis, stenosis, and Facet syndrome. But there's a better way to do this exercise that's very simple that even beginners can include, and it's done on either an exercise bench or the bed. By lying down, if you place one leg up and the other down so that this hip is extended, meaning the thigh is lower than the level of the torso and the lower back. If you bend your knee a lot, your leg is going to be rather parallel or level with the bed and the torso. But if you straighten your leg and let it drop down, allowing your hip to fall off the edge, you can get a little bit of extension. And when you do that, you'll feel, if you have tight hip flexor muscles, a slight stretch at the front of the groin, the side of the hip. In this position, with the other leg aligned straight in the body, you're going to engage your RPI. If you don't know what your RPI or reverse posture isometric is, that's the alignment and the muscle contraction that's unique to your body to bring you back into neutral in terms of a neutral spine, a safe position for your lower back. If you're not sure what that is, go to the Posture Size or the painfreeandfit.com website. We have a free body analysis that teaches you how to learn what your neutral spine is, how to engage your RPI. It's also available on any of our low back healing programs at the painfreeandfit.com website. In this position, we're going to slowly tuck the tailbone under and the pubic bone up. And if you feel with your lower hand underneath your lower back, you'll feel your arch in your back decrease as you use your abdominals to lift or pull your pubic bone up towards your lower ribs or chin. The low back will flatten, and at the same time, you can isometrically tense the buttock muscle on that side. Now, when you do this, what you're doing is you're increasing abdominal tension and strength, increasing and activating the glute or the buttock muscles, and reciprocally inhibiting or relaxing those tight hip flexor muscles. This is a key component for many of us with spondylolisthesis pain, many of us with spinal stenosis, whether it's central stenosis or IVF stenosis, and many of us with Facet syndrome. Holding this position until you feel the hip flexor relax will help to stretch the hip flexor out. And you can also do this exercise for repetitions, holding for 2 to 3 seconds as you flatten the lower back, and then releasing and performing additional repetitions. You can do this to the other side as well, and eventually if you have an exercise bench like I'm on, you can increase the challenge of the exercise by dropping both legs down underneath the level of the bench and simultaneously holding the pubic bone up towards the rib cage, tail under, flattening the lower back. Reserve the two-legged version for once you get really good, maybe 20 to 30 repetitions with the single-leg version. This style has much more of a tendency to arch the back. So if you haven't yet developed your abdominal strength, stick with the single-leg versions and finish off on this as a more advanced exercise. By increasing the length of time that you hold the tailbone under or the pelvis and posterior pelvic tilt, the number of repetitions that you do, you'll be increasing the 3 focal points of many extension aggravated lower back pains, meaning you'll be strengthening the buttock muscles in hip extension, you'll be stretching tight hip flexor muscles, and you'll be strengthening the lower abs' ability to tuck the pelvis over. For those of you with spondylolisthesis, stenosis, Facet syndrome, tucking the tailbone under is a much more important abdominal exercise and movement than crunches and sit-ups, which do serve to strengthen the abdominals, but they don't target that unique motion of tucking the pelvis under, which is what most of us need when we suffer from extension-induced lower back disorders. If you like this video on posterior pelvic tilting with single leg hip extension, Feel free to subscribe to our channel. We got a lot of great videos out there. Questions or comments, write in. I'll do my best to answer them. And remember, if you're looking for a great customized program to help with your lower back healing, look no further than our various programs we have at the painfreeandfit.com website. I hope this exercise, posterior pelvic tilting with single leg hip extension, helps you with your spondylolisthesis, stenosis, and facet syndrome lower back pains.